Welcome to Doctor Saying Stuff. I'm Dr. Alok Patel. This is the place where we deliver health information in an easy to understand format without the frills. Today we're going to talk about otitis media or ear infections. Here are a few things to know. So when we say ear infection, we're commonly referring to middle ear infections because this is essentially what happens when the middle ear gets inflamed, usually from an infection like a bacteria or a virus. What happens is there's a fluid buildup behind the eardrum that causes a lot of discomfort, those telltale symptoms of an ear infection, and that's exactly what doctors are looking at when they make a diagnosis. Symptoms of an ear infection may include things like fever, fussiness, pain, a child tugging or trying to poke their ear, trouble eating, sleeping. Sometimes there's trouble hearing, like a child may not be able to hear things. And remember, these symptoms can be very generic, especially in kids who are too young to say, "Hey mom, my ear hurts." Because guess what? Babies and toddlers can't always say that. You may even see in more severe ear infections actual drainage coming from an ear as well. But all this is why any child who is seen by a healthcare professional for cold and flu symptoms or a fever should have their ears checked. According to data, 5 out of 6 kids will have at least one ear infection by the time they turn 3. So happy freaking birthday, enjoy your ear infection. Just kidding, they kind of suck. Now there's a few reasons why kids are more prone to getting ear infections compared to adults. The first one has to do with the eustachian tube, or this little tube that connects the middle ear to the sinuses. It helps with drainage. In kids, the eustachian tube is shorter and more horizontal, giving bugs an easy passageway to the middle ear. Last but not least, kids have this massive gland behind their nose called the adenoid. And when kids get sick or get an infection, the adenoid can swell up. Not only does that cause discomfort and trouble breathing through the nose, it also is a problem for draining that middle ear. Treatment will vary depending on the severity of an infection, how long somebody's infected for, and any underlying risk factors or other medical conditions someone may have. Check this out. A lot of ear infections will go away on their own, like magic. It's not really magic, it's the immune system. Because commonly ear infections are caused by viruses, which don't need an antibiotic to take care of. Only bacteria need an antibiotic. In fact, overprescribing of antibiotics is not a good thing, not only for our health, but this can contribute to antibiotic resistance, which is a potentially devastating public health problem. That's for another video. What a lot of pediatricians do is recommend a wait and see approach, meaning if a child otherwise looks okay and it seems like a routine ear infection, that child might be safe just to go on their merry way. And then if that kid is improving after a day or two, no need for antibiotics. But if symptoms persist or get worse, it may be time for an antibiotic prescription. Also, some kids may benefit from over-the-counter pain medications like ibuprofen or acetaminophen to help them sleep through the night and deal with some of that discomfort. And I don't need to say this, but I'm going to say it anyway. Basic things, basic tenets of health like sleep, hydration, and good nutrition are also really important for the body, especially when you're sick, but also kind of just all the time. So oftentimes, you're not going to prevent it, they're just going to happen. But there are some things that we can do to reduce the risk. And they're essentially the same protocol as keeping yourself and your child and your family protected against the common cold. Things like hand washing, following proper hygiene, keeping sick kids at home and keeping sick people away from your kids, and also staying up to date with vaccines. These are all really important basic tenets of health and for keeping you healthy and strong and keeping severe colds at bay. And that's it for this episode of Doctors Saying Stuff. Please comment, ask us questions, argue with us, whatever it is. Just comment below. If there's a topic you want to hear us chat about, let us know about it. We're all about having an open dialogue. And be sure to like, subscribe, and follow this channel for more videos. We will see you soon. Stay healthy, everyone.